Hi there, I'm Dr. Abhijit Joshi. I am an oral and maxillofacial surgeon. And in this video, I'm going to be talking about obstructive sleep apnea. So let us first understand what is obstructive sleep apnea and how this happens, how this can happen to you or can happen to anybody. Well, of course, there are many predisposing factors and it need not happen to everyone. But I'll tell you how this can happen. So this is how we would normally be asleep. I hope you can see me all. And this is how the position would be typically, right? So when we are asleep like this jaw gets suspended like this. So when this shifts back, the airway, the entire airway, which moves from here to here, gets obstructed. So typically you would want to be breathing like this. But when you have a situation of obstructive sleep apnea, I'll show you what exactly happens. Observe carefully. You're lying down and the jaw goes back and this is what exactly happens. There is a collapse of the airway. So when you're trying to breathe in, because of certain factors, it could be to do with a large neck, it could be to do with a small jaw, it could be to do with a large tongue. There are many factors, obesity and many, many more. Basically, this is what happens. The air is not able to enter the airway completely. It cannot reach your lungs and there's an obstruction. And that obstruction, when it lasts for more than 10 seconds, for example, when this happens, our brain gets the signal that there isn't enough air going in through the airway. So it wakes you up. And I'll show you how. And this is what happens. So if you have seen or come across anybody with sleep apnea, this is the typical pattern of events that takes place every night for more than 100 times each night. So what is the effect of this? Well, the first effect that this can have on you is that you may feel that you've had a long sleep, but that is just quantitatively. The quality of sleep is affected. So the day after when you wake up, the day after, you still feel deprived of sleep. The patient complains of excessive daytime sleepiness, always complaining of sleepiness while driving, while working on a computer, and so on and so forth. So do all patients who snore suffer from obstructive sleep apnea? So that's a question, right? I mean, most of us snore, but do all of us eventually get obstructive sleep apnea? That's the question. So I'm going to be discussing more about who all are susceptible for obstructive sleep apnea. We will look in all the subsequent videos about how a patient is diagnosed, what are the various tests we run through, what are the various questions we ask, and so on and so forth. And eventually we will discuss about the various treatment options. So thank you so much for watching this video and I will see you in the next part. Thank you.